When I first came to the hospital downtown where you first were for my first appointment, I got down in the basement, and before I even saw you, I thought, this is a very scary place. And I about turned and ran.
What got you to a hospital in the first place?
Well, I had gone by ambulance about 5 times to the ER.
5 times.
They kept sending me back.
What were you complaining of when you went to the ER?
Vomiting, bile. I couldn't eat. I lost like 40 pounds since the first ambulance ride to the 5th ambulance ride.
So you were pretty sick from the very beginning.
Very sick.
But you didn't know why.
I didn't know why. I kept going back home with nausea medication, and on the 5th ride, my mother did accompany me, and she just told the doctors, you have to do something. He's gonna die if you don't. They did a CT scan and they did find the tumor. So that's what landed me in the hospital where I met you. The lady surgeon came in and said, we're gonna do surgery. We're gonna put a port in you. We're going to give you a colostomy bag. And I remember just crying. Well, I'm only 33 years old, and she left. A couple hours later, you walked in, and you said, this is not how we're gonna do it. It's not what's gonna happen. Don't you worry, I'm gonna take care of you. And let's go into surgery, and when you come out, I'll start your care.
So when you went into surgery, this is in an operating room, and they opened you up?
Yes.
And cut out a chunk of bowel.
Chunk of bowel.
And in part of that, they had some lymph nodes.
Correct. A few of them were cancerous. Cancer had spread.
You didn't have it anywhere else besides your bowel and local lymph nodes, which makes it a stage 3 colon cancer. And the standard treatment for stage 3 colon cancer is chemotherapy. If you did nothing, you might be okay, but statistically, over 50% would have the cancer grow somewhere else. You didn't want to have intravenous chemotherapy. At the time, new drug that was approved called capecitabine, and the trade name is Xeloda. It is the precursor to F-dump, and F-dump is the stuff that binds with the thymidylate synthetase, and when you add a little leucovorin, that makes the 5-FU work better. Well, capecitabine is just as good. Capecitabine gets into the cell, the cancer cell, and is converted into F-dump inside the cell.
Wow.
So it's not going to be doing that too much elsewhere.
So I took that Xeloda for 6 months, and from what I understand, I'm the only patient of yours that my numbers dropped to 0.0.
Well, you're one of the few patients who had stage 3 colon cancer, treated with surgery, standard way, and then got, instead of intravenous chemotherapy, as so-called adjuvant treatment, meaning treating the cancer that's there but you can't see it, and you got the oral version, so you didn't need a life port, so forth. But it wasn't all that easy, was it?
No, it wasn't.
Had some side effects.
Yes. So the side effects were not full hair loss, but most patchy. I got the hand and foot where my hands were on fire, burning fire, and my feet were on fire. Could hardly walk. You actually wanted to take me off.
Slow it down, at least.
Yeah.
Give you a break.
Yes, give me a break. And I asked you no. I just wanted to trudge on and kill those bad cells.
Good.
16 years.
16 years.
No more cancer.
It was 16 years ago, I didn't think of him as likely to have a family at all. And look at this.
I didn't know if I'd be around to have a family. Matter of fact, I think one of the first meetings with you before I started my treatment, I told you I have 2 babies. I have 2 babies and I need to be here for them. And 16 years later, I am. And I have you to thank. I truly believe you saved my life. I'm very thankful.